Adam was one tough cookie. He was diagnosed at 15 months, so I don't think he ever knew what a normal life was.
They found a brain tumor that at the time was benign, but it would not stop growing.
I remember going over to him and crying and telling him that I wish that I could take all his pain away, that life would be easier for him. And he said, "Mommy, that's okay." He goes, "I'm brave, I could handle it."
He was very courageous, and for me, he was a role model.
He died before his 12th birthday. He was such a little boy. He just had an unbelievable presence.
Our understanding of the actual issues that parents are confronted with, the weight, the uncertainty, we're taking that experience and making sure that we can fill in those deficits.
David used to call Adam the chill man, and so it was very appropriate that we called it Chillin' with Adam. We provide funding for the care, comfort, education of children with brain tumors and other disabilities.
We work with 3 individual programs, NYU Hassenfeld Clinic, Montefiore Children's Hospital, and Brookdale Hospital, to try to, make really sharp, targeted impacts for these kids.
Our goal that we're trying to reach is just make people cognizant of what's going on.
These are very rare diseases. 2,000 kids per year in the United States are afflicted with these disorders, and it's very difficult to mobilize, a public.
When I was 14, I had a seizure, which was caused by a brain tumor. Instead of me thinking about, what's homecoming or going on, now I had to think about what's in my brain.
I had a tumor, and as a result, during the operation, I had a stroke.
The first couple of months of my treatment was really serious. I couldn't be around too many people.
Everything was confusing, and I didn't know what was happening to me.
When they first told me that he had leukemia, the first thing that went through my mind was that he was going to die.
It's like you've joined the club that no one ever wants to belong to.
We work with the hospitals to give us a detailed ask list of things that could be impactful.
We funded families in need. One of the purchases we made was an MRI machine that had like a DVD player in it.
It supports the psychological integrity of not only the child but the family throughout a very difficult period in their lives.
The organization funds a child life specialist who works with our patients to help them deal with the diagnosis of cancer.
The hospital can be a scary place for kids. This kind of gives them some control. And this, it's a good way to give kids some developmentally supportive medical education, help them understand what they're going through, and it's also a way for them to gain mastery over this environment.
The Chilling with Adam is a phenomenal foundation that gives great gifts to the Hassenfeld Center and all of our patients. The library is quite unique, and the ability to have physical therapy on site is amazing.
Giving them that physical therapy gives them time to play, and it gives them a really uplifting and enjoyable part of their life, which I think is really important.
I was using a walker. Now I use a cane.
I work here at the Hassenfeld Center. I'm a librarian, and it's a place to kind of get away from a crowd and the waiting room, and I help with patient education.
As a mom who has to bring their child to a pediatric oncology clinic, having your kid not want to leave is like pretty much the best thing that you could possibly ask for. The fact that I was able to get medical information was really important.
When we were at the hospital, there were plenty of parents where there was one parent or no parents when the kids were going on to therapy. And then you realize that one parent couldn't take it, so they bolted. And the other parent was told by their employer that if they didn't come to work, they'd lose their job.
When our children are diagnosed with cancer, it impacts the families. Normally the families have to stop working to care for the child.
My mother had to stop working for a while, actually, a few months, just to provide the help and support that I needed during the time. But because of those foundations, she was able to go back to work.
Every summer we do a family fun day. They get to do whatever they want and take their minds off of their treatments.
It makes so much difference. They had a day when they could be a family again. Just having foundations who are willing to help us and provide games for the children because they get so depressed. They need these distractions to help them go through treatment. And a lot of people may not understand how simple these things are, but the impact is really big.
It's good to know that people do understand and care about you and where you're coming from and what you're going through.
It definitely is a life-changing organization.
It's not just one child they want to help, it's not just one hospital. They want to spread themselves to everybody that's around them.
It made a difference in my life and my son's life.
Adam was a brave, courageous little boy, and all he wanted to do is live life like every other kid.
This foundation has allowed our family to smile again, to feel good about him.
It's helped me be a better person, and it's really helped me live with the challenge of losing a child.
I don't want anybody to ever forget who he was and the place in this world that he had.